This podcast is brought to you by Conquer Cancer, the ASCO Foundation. Our mission is to accelerate breakthroughs in life-saving research and empower people everywhere to conquer cancer. Welcome to Your Stories, a podcast where we hear candid stories from people conquering cancer. I'm your host, Brenda Brody. Whether you're relaxing on the beach, having a backyard barbecue, taking a hike in nature, or hitting your favorite water park, we've heard it time and time and time again. Protect your skin. Apply your sunscreen. You know the drill. Excess sun exposure increases the risk of skin cancer. And while some skin cancer risk factors are unavoidable, being proactive about the preventative steps we can take, like applying sunscreen and limiting sun exposure, is one factor we can control. But what if you could do something more? Something that not only protects yourself from skin cancer, but people around the world. Although numerous milestones have been made in the skin cancer research and treatment, there remains significant room for improvement when it comes to treatment and care. Dr. Lynn Schuchter is director of the Tara Miller Melanoma Center at Penn Medicine and a former president of the American Society of Clinical Oncology, or ASCO. Having dedicated her career to caring for patients with skin cancers, Dr. Schuchter knows all too well how much progress still needs to be made in the field of skin cancer research and care. Today, Dr. Schuchter joins us on Your Stories to talk about the importance of prevention, patient-centered care, and the past, present, and future of skin cancer research and treatment. Welcome. It's an honor to have you and nice to see you again.
Thank you so much, Brenda.
Before we get started, can you share with us, how did you get involved in oncology and then specifically skin cancer and melanoma?
I always was interested in studying cancer and understanding how to improve the outcomes. And it was really in medical school and residency that I was very drawn to the patients. The experiences of taking care of patients with cancer is special. The conversations are very real. The issues that we discuss are really real. And I just found that how you communicate with patients and their families, it just became an area that I wanted to focus in. And then when I was an oncology fellow, I knew I was interested in a type of treatment called immunotherapy. And back then, when I was in training, we only had glimmer of an idea of the power of the immune system and how it could maybe be used to treat cancer. And melanoma, a type of skin cancer, and the serious type of skin cancer, is one where there were a lot of clues that maybe an immunotherapy approach might be useful. So the combination of patients that really had an unmet need in terms of what treatments were available. And it is a little strange that truly a disease grabbed me during my fellowship, which is now more than 35 years ago. And I have focused over these, more than 3 decades on the serious form of skin cancer, melanoma. And it's been an unbelievable experience because we had no effective therapies in the past. And now we are just seeing so many advances. Yes, immunotherapy, which maybe we'll have a chance to talk about, but also this really powerful approach with targeted therapy, understanding the genes that are broken in melanoma. And so now, patients with stage 4 melanoma cancer that has traveled may be cured with these new treatments. So it's been amazing and exciting. And every day I had clinic many times this week, the patients are just amazing. And it's been a joy and a privilege over all these years.
Well, that's an incredible journey, and we need more oncologists like you because as a survivor, not of melanoma, but of breast cancer, I know what you all go through day in and day out with helping us as patients understand what we're going through and the risks. And hopefully, one day, no one will pass away from this cancer, but we're still seeing a lot of melanoma and skin cancer. And so I'm grateful to hear that you have spent 35 years focusing on it. Can you help break down what's the difference between melanoma versus skin cancer?
You're right. Good question. So melanoma is a type of skin cancer. So there's three broad categories of skin cancer that, and most people have heard of these, but basal cell skin cancer, that's very, very common. In fact, it's the most common cancer. And as people age and with cumulative sun exposure, basal cell skin cancer is really, really common. We maybe have a chance to talk about what they look like. Squamous cell skin cancer, another very common type of skin cancer, both basal cell and squamous cell associated with lots of sun exposure and just really common as we age. Melanoma is the least common type of skin cancer, but it is the most serious. So basal cell and squamous cell skin cancers easily treatable. The dermatologist can freeze it, zap it, remove it, rarely travels to lymph nodes or distant sites. But melanoma is the one that can metastasize, that people can die from. And so this is why early detection, understanding what melanoma looks like early, if we detect melanoma early, then we can prevent it from traveling and, prevent patients from needing treatment. So we want especially to raise awareness of what melanoma is, how to prevent it, how to recognize it, how to treat it, because the power of early detection, we can really increase the cure rate. In fact, most melanomas are actually cured with surgery. And so that is why it's so important for early detection. We don't need to do a lot of treatment.
Do you recommend that we as patients go in yearly to get our skin checked? Besides just being aware of our bodies, is there a specific recommendation at a certain age with this type of cancer?
So, you know how there are clear guidelines for screening for breast cancer and who should get mammograms. There's clear guidelines on risk for colon cancer and who should get colonoscopies. There isn't these blanket recommendations about everybody getting a skin exam. So we first say, well, understand if you are somebody who's high risk for developing a skin cancer. So this is people who have blonde hair, red hair, blue eyes, burn easily, family history of skin cancer and melanoma, lots of sun exposure, and certain types of moles. So I do think it's important that people are aware, as you said, of what is on their skin, and that when they see their primary care providers or their gynecologist, whoever's providing primary care, to address the skin exam as they're having a physical exam. What's really important is for people to understand, like, what is on my body and what's changing. Maybe I'll just share with you quickly. There's this thing called the ABCDEs of trying to detect a melanoma. So melanoma generally starts in a mole. So a mole is a pigmented, has brown, usually a brown spot. Occasionally people's moles are pink if they don't have much pigment. And then the ABCDE is if you saw a spot on your skin, it was asymmetrical. A, the two halves didn't look alike. B, it was an irregular border. A mole is often just round and really regular. Variation in color, C. Diameter, bigger than a pencil eraser. But E is the most important one, is evolution. That is change. So if people notice a spot on their body that's changing, that's one to draw attention to your provider. The other way that we want people and clinicians to identify it is we also think about the ugly duckling. So on your body, you might have a lot of spots, but what looks really different from the rest of the spots on your body? We call that the ugly duckling. That is something you might bring to the attention of a provider. I just want to also say, This is not expensive to screen for skin cancer. This is a simple skin exam. This is being aware. This is showing it to somebody and they do a biopsy. It doesn't require colonoscopy prep. It doesn't require radiology. It's simple. And there is an epidemic of melanoma in older white men, and these tend to be on the trunk and on the back, and young women. Men tend to have melanoma on their back and on their trunk. I mean, it can be in any parts of the body, especially sun-exposed parts of the body. Women tend to have more melanomas on their arms and their legs. So just important that, we do make jokes. It could be a fun weekend activity for a couple to examine each other's skin and see, what do you see? It's hard to examine all the parts of your body. But I would encourage anyone who's listening to this podcast, take a moment, do a self-skin exam, get the mirrors out, get a partner to help look, and see what you see.
Great advice. Thank you for sharing that. How do you predict melanoma prevention, research, treatment efforts, and how they might evolve around the world as our world gets hotter and the ozone layers are rapidly depleting? Do you have any thoughts in this area?
Yes, so we definitely, as I mentioned earlier, we are seeing an increase in the incidence of skin cancer and including melanoma. This is in part related to more, the kind of sun exposure that increases melanoma risk is intermittent sun exposure. We know research shows that depletion of the ozone has increased ultraviolet UV radiation at the Earth's surface. So there's a lot of sun exposure. So we do see a growing incidence of skin cancer around the world. And with hotter temperatures, with depletion of the ozone, we know that one of the causes of skin cancer is, and the main cause is sun exposure, and that's ultraviolet UV radiation. And so we definitely there's links between the hotter planet, depletion of the ozone, and rising incidence. Some people are protected from skin cancer because of their pigment. So this is not affecting everybody. So people with more pigment, African Americans, have less risk of skin cancer and melanoma. But in fact, we're seeing melanoma in Black patients as well. We see some skin cancer in Latino population, Hispanic populations, but pigment does help protect against some skin cancers.
What strength of sunscreen do you recommend that we all use?
Right. So I'm going to say that, we definitely want to reduce sun exposure. And so we want to, seek shade, be under an umbrella, the importance of clothing before I talk about which sunscreen to use. But, wearing a hat, wide brimmed, covers the ears, back of the neck. I mean, it's really important to cover the tops of the ears. There's actually clothing that has SPF and UV protection in it. So people who really burn easily, I really recommend some of these clothes. They're lightweight and they really protect the sun. So sun avoidance. I don't want anybody to be hermit. I mean, I'm going out this weekend, but I will be applying my sunscreen. And so which sunscreen is, it should be one that says broad spectrum. And so that is covering UVA and UVB. Ultraviolet B is the main culprit associated with melanoma, but you'll see on the sunscreen label, it will say broad spectrum and it covers UVA and UVB. For most people, an SPF of 30 is sufficient. As you go up in SPF to, 50, 70, you don't get that much more protection. And the key here is that people don't use enough sunscreen or reapply it often enough. So really, it's a shot glass full of sunscreen. That's what you really need to cover your face, your neck, your hands, or, your sun exposed areas. And the key here is that it should be reapplied about every 2 hours. And ideally, you put your sunscreen on 15 minutes before you go outside so that it really is in your skin before you go out. and really can be used in children. We don't do it put on babies. Kids should wear sunscreen as well. And this is where, we want more legislation about having sunscreen available on playgrounds. We want playgrounds covered in tarps. Like when I'm driving and I see these playgrounds that are just, no protection, no trees, no tarp, in Australia, where you have this terrible combination of people who are very fair at a latitude where there's so much sun. They have some of the world's highest risk of skin cancer and melanoma. You'll see at the Australia Open tennis tournament, like compare the people in the stands. They're covered. They know about slip, slap, slop, wearing a hat, putting on the sunscreen. Their playgrounds are covered. And you look at like the audience at the US Open here, and we're just like totally sun exposed. So this is a cancer that can be prevented, but it's early detection and prevention through avoiding sun exposure and sun damage. There are studies looking at other kinds of prevention, like is there a pill you could take? Are there other, medicines that you could take to prevent it? But they've been studied. There's nothing yet about saying take a pill and you can prevent skin cancer and melanoma. It's really about understanding risk factors, getting moles and changing skin lesions checked, and avoiding excessive sun exposure and sun burning. Those are really the keys to improving outcomes for patients with melanoma.
Thank you for clarifying that, because we all have heard that we need to protect our skin. But when I go to the store, I never know, is 30 going to help me? Does 100 get me anywhere? So thank you for breaking that down for us, because I think that's really important for us. Like you say, prevention will help and clearly save lives in the end. Would you share with us some of the current unmet needs in melanoma research and how the average person like me can make an impact and help in this area?
Yes, so there's been, huge advances in the treatment of melanoma. I mean, actually, one thing is that we know that we used to do giant surgeries to treat melanoma, either to remove it or when we were removing lymph nodes. Now we know that simpler surgeries can be done and the same outcomes. There's so many advances in the immunotherapy. So if we don't detect melanoma early, you can travel to lymph nodes. We give treatment to try to prevent a recurrence, or we give treatment if we know we're dealing with metastatic disease. But not all patients are benefiting from these treatments. So we still have a ways to go to be effectively treating all melanoma that has spread and traveled. Melanoma is a cancer that also has a high chance of traveling to the brain metastasis. So when we're talking about advanced melanoma, like in the lung and the liver, but we know that melanoma can also travel to the brain. And this is a big unmet need for research in terms of how to best treat melanoma in the brain and getting more effective therapies. There's clinical trials now looking at vaccine strategies. These are vaccines, not so much to prevent melanoma, but to treat melanoma. And this is a whole new area of exploration. There are ongoing trials really taking advantage of some of the technologies that were developed with the COVID vaccine, with the mRNA technologies, turning this into powerful melanoma vaccines. So we're optimistic that more effective treatments are coming, and the pace of discovery has been remarkable. But investment in research is essential. Conquer Cancer is investing in researchers that can find these new approaches. So we need more investment in cancer research to really continue to see these kinds of improvements and see that more patients are benefiting from these new advances.
Thank you for clarifying that. And for those listening, conquer.org is where you can go online and you can donate. The monies that are raised by Conquer Cancer on conquer.org go towards research, and you can specify if melanoma and skin cancer is something that you want your donations to go towards. You can specify that, and they're happy to put your funds towards cancer research in this area. Well, thank you for that information. We've touched on so many things. We're hearing a lot about AI. I was just at a meeting this week that was not in the healthcare space, but everyone was so excited about how AI is going to positively impact research. Can you share with us about how that can be applied with regards to skin cancer and early detection?
Sure. So we do think the power of AI will touch all of oncology, how we deliver cancer care, maybe how we match a patient to a clinical trial to get the latest treatment, maybe to better understand the genetic makeup of their cancer, to apply the right treatments. But what's also really exciting, we've been spending a lot of time talking about early detection. So how can you tell on a body with multiple spots all over which is that ugly duckling, which is the one that's changing? So there's really interesting technologies to do 3D photographs. Okay, so you stand, yes, you're undressed, and you get total body image of your whole body to see its mole mapping. But you can now apply AI algorithms over time then to say, which is the spot that's changed? I mean, doing that manually, like right now, yesterday in clinic, patients had photographs. I looked at their printed photographs. I looked at their skin, like from my eye, what's changing. But AI is going to be in a second be able to say that spot changed, or this has the characteristics that this needs to be biopsied. So in a sea of 100 spots, which spot needs to be biopsied? So we are seeing the incorporation of AI now in trying to identify skin cancers early, and especially melanoma. And so what we saw at our ASCO annual meeting just this past month in Chicago, the pace of the incorporation of AI into oncology is incredible. And we had more than 100 abstracts submitted to the meeting, which were talking about AI. One was, how can we improve access to screening through AI? So if I know, I'm at the University of Pennsylvania, and there's risk factors that are identified in the chart. What algorithm could be pulled to say, this is the person that needs skin cancer screening. This is the person that needs to get into the dermatologist and prioritize that dermatology visit. So I do think that technology is here. Of course, there's concerns and biases, and it's not perfect, but we're really excited about embracing this new technology. I think it's really going to be transformational for our patients and for our investigators and our physicians.
Well, that is just so exciting to me, having gone through major treatment for cancer, to know that AI may change the face of early detection is just incredible. Very exciting. And there's so much fear around AI. So it's so wonderful to hear the positives that are happening also. And it's just so much excitement around it. And it's so rapid with its pace. It's exciting to know that this is going to impact science in such a positive way. 5 years from now, what milestones in melanoma care do you anticipate, if you do anticipate 5, 10 years out, and how do you see donor funding research contributing to the advancements? I know we talked a little bit about it with, I don't know if people understand about grants to help with research, but if you could break that down for us, it would be wonderful to learn from you.
I mean, I do expect that we will be detecting cancer earlier, that we will have better ways to know who's at risk for recurrence of cancer and who's not. Right now, so just take, for example, stage 3 melanoma, which is melanoma that's traveled to lymph nodes. We pretty much give everybody a year of immunotherapy. But we would love to know who doesn't need that treatment and who really needs that treatment, or who can we predict might have side effects and who might not. I think the research will be better at predicting risk of recurrence. I think we'll be able to give less treatment. I think we can detect cancer earlier. And we're very excited about this prospect of liquid biopsies or using blood samples to detect microscopic cancer cells, as identifying who's at risk for recurrence or early detection to apply new therapies. So again, I feel really optimistic about the future because of the pace of the scientific discoveries. But back to leading to, this takes dollars to support the research efforts. And that's where Conquer Cancer comes in, and all, the donations to organizations to fund cancer research. All the advances I've just described and that I've seen in these 35 years have come because of new advances, new treatments, patients participating in clinical trials, then FDA approval. This cycle, discovery, new drug, testing it, all of this is funded by research and grants. And that's where Conquer Cancer plays such a critical role.
Thank you for sharing that. So, in summary of what I'm hearing, we've got two areas. We as individuals can prevent this disease if we really take care of our skin and protecting ourselves. And two, supporting research, because research saves lives. We know it. I'm here because of it. And it's an exciting time in research with everything happening that you all are working on and with AI. We see a lot of growth happening, and it's really exciting that one day may no one die of this disease. Do you have any other thoughts that you would like to share with us?
Yes, I just want to mention one other thing. And so, as people are gathering this summer and you're having family picnics and family reunions, I want everybody to know their family history of cancer. So occasionally, melanoma runs in families, or it can run with other types of genes. I'm sure our listeners are familiar with the hereditary breast cancer gene, BRCA1, BRCA2. That's also linked to melanoma. So I ask my patients every visit, has anybody in their family been diagnosed with cancer? Because this is how we know if you need to get into a dermatologist or other types of screening. So I would encourage people to share your information about your own cancer experience with your family members, and make sure your doctors and team know about that family history. Because if there's a family history of skin cancer, that identifies somebody at higher risk, and they need to make sure they're taking the precautions and, importantly, getting those skin checks. You mentioned it can be prevented, but importantly, it can be detected early and then cured. And so this is why we're speaking this power of education and knowledge, so that people can be proactive about their health and stay healthy for a long time.
Thank you. What does conquering cancer look like to you?
I don't know if cancer can be gone, but I think it can be detected much earlier, treated with less toxic, less invasive ways. And I think that we want to see patients living healthy lives, that our survivors are also really healthy. So huge focus on less treatment, less toxic treatment, making sure that our survivors are really healthy. And I do think it's in our lifetimes that we'll be detecting cancer at a much earlier point, when we don't need to give so much challenging therapy. I don't think it used to be people hear cancer and it still is scary to hear those words. But now the treatments are so different. And so even today and in the future, I think we just see it's a very different world than when I first entered this 35 years ago. Science leads to cures.
Thank you. And prevention saves lives. I'm making my dermo appointment when we get off.
Very good. Very good.
Well, thank you for listening to this podcast brought to you by Conquer Cancer, the ASCO Foundation. Conquer Cancer is creating a world where cancer is prevented or cured, and every survivor is healthy. You can make a gift at conquer.org/podcast. The participants of this podcast report no conflicts of interest relevant to this podcast. Full disclosures can be found on the episode page on conquer.org.